Hello, everyone. My name is Allison Blake. I'm a success coach with Stepping Stones to Mental Health. I am here today to talk to you about self care in the time of COVID-19. With everything that's going on right now, it can be a little tricky trying to navigate our self care, especially if you're working from home. So, this presentation is going to take you through some suggestions, some tips on how to balance your work life with your home life and making sure that you're not burning yourself out. COVID-19 isn't just a threat to our physical health, but to mental health as well. It's important that we all take care to manage our mental health during this time. So, we're going to go through some tips and reminders as to how to do that, such as how to stay connected, managing working from home, and finding hope in what can be a very scary time. As you can see here, there's lots of reasons why this pandemic could be triggering for mental health issues, especially if people are self isolating, they're not able to have those connections with other people, possibly their support systems, and just a general increased anxiety around their own health, the health of their loved ones, financial security, right, job security, and just trying to figure out, okay, how are we going to get through this? So here are just reminders from Alberta Health Services around social distancing. The goal here is to limit the number of people you come in close contact with. So it's not the same as self-isolation where you would remain indoors. With social distancing, you can go outdoors. Just make sure you're maintaining that distance of at least 2 meters between you and another person. So go out for a walk by all means, but you're not going to be clumping together in big groups during that walk. So keeping 6 feet, about the length of a bicycle, or the length of a llama, as I heard the other day, from others when you're going out, limiting the number of times you leave the home for errands. So maybe doing a weekly grocery shopping trip instead of every other day. Trying to shop at less busy times and ordering online to have your groceries delivered, or even the curbside pickup so you're not going into the store. Following Alberta's recommendations on mass gatherings. So we saw that it started off with nothing over 250, it went down to 100, down to 50, right? Just making sure you're keeping updated on that and following those guidelines. And then washing and sanitizing your hands after you're touching communal surfaces. That is really one of the best things you can do. The virus has a very weak protein barrier around it. So washing your hands is a very simple and effective way of getting the virus off you if you did get in contact with it. So why are we doing this? The goal of social distancing is to flatten the curve. It's not just to protect yourself, but to protect everyone else as well, especially those who are in higher risk groups, like the elderly and those who are immunocompromised. If we do nothing, then the cases needing support are going to overrun the healthcare system. But if we take the precautions that are being recommended, we're being careful, not panicking, but just following those recommendations from Alberta Health Services, there's going to hopefully be fewer cases. And then the cases that do need support will have the support they need in order to get better. All right, so let's look at some working from home tips. So I know the last one did say, yay, no pants, but kind of our tip number one is to get dressed, right? You don't have to do a full hair and makeup and get all glammed up, but wearing something other than the PJs you slept in last night. It's really going to help in creating that division between your work and your home, right? Also, making sure you're waking up more than 5 minutes before your workday starts. You need to give yourself time to prepare for the day, mentally and physically. You also want to have a designated workspace, right? So make sure you're not working from your bedroom if you can avoid it. You want to maybe have that space as in your bedroom as this is where you go to relax versus this is where you're having your meetings with your boss. So have that designated workspace where you can go, you can focus. Hopefully you have some good support for your back, nice comfy chair. You can get your work done there. All right. Ground rule number 3, you're going to want to set a schedule and stick to it. Now, this doesn't mean you're going to have the same schedule every day, but you want to have something similar. So it might not be, okay, every day at this time I get up and I do this specific activity. It might be my mornings are going to be for meetings, my afternoons are going to be for developing resources or doing some research so I can better support people, right? You want to have a schedule like that where you know, okay, at this time every day, I'm going to have lunch. These are when I'm going to take my breaks and stay to it as much as possible. This is going to help you feel more in control. It's going to let others in your home know when you're available versus when you're working, and it's going to give you a semblance of normalcy. All right, and don't forget to keep your healthy habits. Right? Working from home, it's very easy to get caught up in our work and realize, oops, I missed lunch. Okay, I guess I'll just push on through and I'll have dinner a little early or something. Right? It's also easy to be really mindless when you're eating. Right? You grab that bag of chips that's sitting next to you at your desk and you're just kind of mindlessly eating it. So make sure you're paying attention to what you are doing for your physical care. Right? Make sure you're eating healthy. Make sure you're getting the right amount of sleep. Make sure you're getting exercise, right? Maybe you can't go to the gym right now, but what can you do at home, right? There's lots of at-home workouts on YouTube. A lot of gyms have uploaded workouts if you were a member there before, right? Or even just, okay, I'm going to go for a walk around the block, making sure to maintain your social distancing. Also, make sure you're scheduling breaks. So taking frequent breaks is so important so you don't burn out. When you're in the office or at the school, you're probably not actually working 100% all the time anyway. You have those natural built-in breaks, whether it's talking to a colleague, when a student comes in, you're having a one-on-one conversation with them, right? Walking to go to the bathroom, get a drink, right? Any of those little tiny things that we don't get when we're working from home. So it's really important that you're scheduling in breaks and you're actually taking them. If it's 1 o'clock and you go, oh, I missed my lunch break, you know what? Take your lunch at 1 o'clock. That's fine. Breaks are very important for our physical and our emotional health, right? They're going to help us prevent decision fatigue, which is basically when your prefrontal cortex becomes overwhelmed with having to make decisions, which a lot of us are having to make decisions right now. And it can be kind of tricky because we don't have all the information or information is changing very quickly. So your prefrontal cortex basically gets tired. And if you just keep pushing it, it's not going to work as well. You also need breaks to restore your motivation, right? How many times have you been working really hard and you're sitting there working, and then you're like, oh, I just want to be done this. I don't care anymore, right? You lose motivation. Breaks are also going to increase your productivity and your creativity. And this is something that we all need a lot of right now, especially the creativity, right? We're having to figure out new ways we can interact with students and families. So being able to have that break, recharge your brain, let it just rest for a moment and get away from whatever you're doing for work. Breaks are also going to consolidate your memory, improve your learning, right? It's the same reason we tell students to take breaks when they're studying. Your brain can't go 100% all the time. And then finally, there's this 20-20-20 rule. So it's been studied, right? The best thing to do to reduce eye strain, every 20 minutes, take 20 seconds to look at something 20 feet away if you're working on computers, right? Taking those breaks, letting your eyes rest is going to be so good for your health. And finally, make sure you're making time for you. You're having that me time where you shut down and you enjoy life. Overworking can be a real issue, so clearly define what hours you're going to be working and stick to it. At the end of your workday, sign out, turn off notifications for work-related emails, instant messaging, right? Especially if you signed in on a personal device. Make sure you're having that clear divide between when you're working and when you are not. And when you're not working, you're taking that time to relax. Again, working from home, it's very easy to blur the line between home time and work time because you're already at home. There isn't a physical distinction between home and work anymore. So making sure you're really making that time for yourself. Right now, a lot of us want to do something to help. Unfortunately, right now, a lot of us also aren't making the best decisions. The news about COVID-19 is changing fast, and people are trying to make decisions about everything from whether to cancel vacations to how best to protect themselves and their communities. There are a lot of reasons why you might find decision making difficult right now. So, first, there is this present threat going on. The disease is real. Around the world, people are dying from it, and it's spreading rapidly, that there's new news every day. Humans are wired to pay attention to threats, so this is the story that captures our attention. Other things are still happening in the world, but because of this threat from this, that's what we're paying attention to. There's also a lot of uncertainty about the spread of the virus. So how many people have it, how quickly it's moving, what are the proper precautions that need to be taken. When it comes to future projections, we're really good at understanding linear trends, but really bad at understanding trends that involve accelerated growth, like an exponential function, which is what we're seeing right now. At the front end of a bloom in a virus, there's going to be fewer cases, but they can grow rapidly. The uncertainty that creates for people increases our attention to it. Third, people have very little control over the spread of the virus. We can engage in actions like washing our hands, avoiding touching our faces, and practicing social distancing, but there are many aspects of the situation that are out of our control. We don't get to decide when the city shuts down the parks or what businesses are open or closed. People don't like to be in situations where they have no agency. It creates additional anxiety, as well as a desire to do something, anything, to reassert control. This leads to actions like buying hand sanitizer and stocking up on toilet paper because it lets people feel they're doing something. Finally, all the attempts to control the spread of the virus are fundamentally about prevention. This means that if we're successful, some people will not get sick. Unfortunately, we don't get a run and control condition in which those measures weren't taken. As a result, it's hard to know which actions and programs are having an impact on creating the absence of the disease. It's very hard to measure a negative. So in the end, we won't know if we were being overly precautious and going too far, or if we did exactly what was needed. All four of these factors are affecting our behavior and decisions we make. The threat, uncertainty, and anxiety lead us to make very short-sighted decisions because we want to do something, anything, to feel like we have control again. One of the best things you can do to lessen your own anxiety is disconnect from media. And media includes social media as well. So, first of all, choose your time to interact, right? Don't have the news running 24 hours a day in the background. Make sure you're taking that time where you're able to dedicate to paying attention to the news and emotionally dealing with what's being talked about. Choose a time, stick to it. Make sure you're listening to reputable sources as well. So this is where social media comes into play. You're not just reading Facebook reposts, right? Check information from Alberta Health Services, the World Health Organization, those official sources where we know the information is accurate. Turn off your news alerts. Since the majority of news alerts right now are by default negative, try turning them off. Shutting off push notifications to your phone or email. These alerts pull our attention away from the present moment. They're going to distract us, and eventually you're going to hear that ding of your phone and you're going to feel anxiety rise because you don't know what bad news is coming next. In relation to that, change the ratio. Start your day with empowering, solution-focused news. Seek out stories on your favorite news sites that are transformative, which means that they empower people with action steps and potential solutions instead of just focusing on the problem. Maybe you skip clicking on stories that are hypothetical or about tragic one-time situations that you can do nothing about. Look for the positive. We also need to remember to slow down. Things are still developing and changing every day, and you don't need to do everything right away. It's okay to not have all the answers also. If someone asks you a question and you don't know the answer, it's all right to say, you know what, I need to look more into that. Let me get back to you. Slow it down, focus on one thing at a time. There's a lot of information out there right now about the virus and how to react. Take the time to read and digest it before making important personal and business decisions. There are many actions people could take over the next several weeks and months, but the decision to act should be based on deliberation, sober reflection, on data, and discussion with the experts, not on reaction to a headline or a tweet. Fast judgments are generally biased towards action, so you need to slow down to make sure that the quick action is actually warranted. In times of crisis, staying connected with others is so important. Humans are social creatures, and in times of stress and illness, being deprived of social connections can create more stress and illness. Being isolated increases stress and depression and decreases the immune system, putting you at higher risk. Now is the time to reach out to friends and family and connect with them however you can. Let people know how much you care about them. While live human connection is best, a phone call with a real voice is better than text, and a video chat is better than a phone call. If you're in self-isolation, connect with the people there with you. This is the time to strengthen those relationships with your partner, children, or roommates. You could organize a family movie or game night, cook together, or be home workout buddies. What you say when connecting also matters. If you're stressed and upset, talk about your feelings can help. You may or may not feel better, but you will feel less alone. If you're on the receiving end of this kind of sharing, resist the impulse to dismiss, debate, or tell the other person not to worry. Your task is to listen and convey that you understand their feelings and accept them. This process of one person sharing something vulnerable and the other responding with understanding and care is the basic step in close, good relationships. Human touch is also vital for well-being. If you're distancing with people who are close to you and healthy, don't forget the positive impact of a gentle hug or holding someone's hand. Safe, mutually consenting physical touch leads to the release of oxytocin. Sometimes called the love hormone, oxytocin helps you regulate your fight or flight system and can calm your body in times of stress. What else can you do to stay connected? Well, here are 5 things you can do to make a positive difference in your community that's going to help with connections. First, think of others, consider your actions, and be kind. Connect and reach out to your neighbors. Ask if they need help in getting groceries or any other supports. Make the most of your local online groups. Facebook and Twitter have become great places for communities to gather. Support vulnerable people or isolated people, again, reaching out, asking if they need groceries, if they need help with anything. Right? There's apps like Nextdoor to see if your neighbors need assistance. If you're worried about transmitting the virus, you can always leave the bags on their doorstep. And then make sure you're sharing accurate information and advice from those reliable sources that you know are giving out the truth and not just fear-mongering. In stressful times, it's easy to push our feelings down just to get by, but this only leads to more problems in the long run. So notice your feelings, name them, and accept your thoughts and emotions. Engage in enjoyable solo activities. Yes, staying connected with others is important, but you also need to enjoy your time alone. And practice self-compassion. Everyone is figuring this out as we go. There's going to be mistakes. We're only human. So forgive yourself for those mistakes, learn from them, and move on. Other supportive activities include practicing gratitude. There's a lot of scientifically proven benefits, but overall, it's just going to help you feel better. You're going to strengthen those relationships with the people around you, especially when you're expressing gratitude to them. And even though things might be kind of scary right now and uncertain, there's still a lot to be grateful for. So, whether this is practicing gratitude through a gratitude journal or going around the table at dinner time and saying one thing you're grateful for, this is a great way to help yourself feel better and to boost your mental health. Practicing kindness is another good way to boost your mental health during this time, right? As Mr. Rogers' mother would say, look for the helpers. You'll always find people who are helping. And it's true, there's lots of examples of kindness happening in the world right now. Canada has this thing called caremongering, which we started, which is people coming together to support people in their communities. In less than 72 hours, there were more than 35 Facebook groups that were set up to serve communities across Canada. They had more than 30,000 members between them. People are joining the groups to offer to help others within their community, particularly those who are more at risk of health complications. There are other examples out there too, like this one of an NBA star who said he would spend some of his salary to pay the arena workers who were out of work due to the season suspension. Other places, restaurants and soup kitchens, are offering up food for students who may not be getting meals at home because school is a place where they got food. There's lots of examples out there of people being kind, and being kind does lots of good benefits for you. It boosts your health physically and mentally, as well as making the world a bit of a brighter place. Humor is also a useful tool in helping to cope with cabin fever during a lockdown. Whether it's jokes, memes, or funny one-liners, it's going to engage people remotely and create a sense of social well-being. Laughter is a strong medicine. It draws people together in ways that trigger healthy physical and emotional changes in the body. It strengthens your immune system, boosts mood, diminishes pain, and protects you from damaging effects of stress. Nothing works faster or more dependably to bring your mind and body back into balance than a good laugh. Humor lightens your burdens, inspires hope, connects you to others, and keeps you grounded, focused, and alert. It also helps you release anger and forgive sooner. And to go with our humor, here's a nice fun tweet. The World Health Organization has announced that dogs cannot contract COVID-19. Dogs previously held in quarantine can now be released. To be clear, who let the dogs out? You also need to have hope. In order to maintain your positive mental health, you need to take breaks from the panic and worry. Look for reasons to be hopeful about the world. This can include the acts of kindness people are doing for each other, or how communities are coming together every day, even if they can't physically be together. Many communities are setting up things like a chalk walk, where you write positive messages in sidewalk chalk for others to see while out. Look for the good in people, like all the artists who are sharing their work for free, whether it's Broadway shows or people giving concerts from their balconies. Good things are still happening in the world, like people getting engaged and families coming together. This is a unique time in which we can slow down, reflect, listen, and show gratitude towards one another. And look for good that is coming out of all of this. Pollution is clearing up in cities that implement self-isolation guidelines. Scientists are discovering cheaper ways to make ventilators, meaning shortages will be lessened in the future. Entertainment options are being opened up for free, so those who would not have been able to afford them before can enjoy them now. And more than 100,000 people have already recovered from the virus worldwide, including people in their 90s. And finally, reach out for help when you need it. Our Employee and Family Assistance Program provides you with immediate and confidential help for any work, health, or life concern. They offer counseling via phone, web, or mobile app, as well as guidance in finding supports. Alberta Health Services Tough Times page is a compilation of supports and resources to manage these tough times. There are specific COVID-19 resources, as well as more general mental health supports and community supports. Alberta Health Services also launched Text for Support. If you text COVID-19 HOPE to 393939, you'll receive support and encouragement to manage your mood via text message. And then finally, the RVS Continuity Plan, which is a go-to source for Rocky View School families and staff to find information on how the school district is responding to COVID-19 and what supports are being offered. Please reach out to any of these resources for support, guidance, or even just some reassurance on these tough times.